Hi everyone, I'm Dr. Akhila Ayyagari, consulting fertility specialist at the hospitals in Jara Hills, Hyderabad. Today we're going to talk about the causes of male infertility. So first, quickly understand what is infertility. It is the inability to conceive after regular unprotected intercourse for a period of 1 year. Now, this can be because of female causes, male causes, combined male and female causes, or unexplained infertility. So, in put together, about 30 to 40% of infertility is because of factors associated with male causes. So, infertility, like I always say, it's not just a woman's problem; it's a couple's problem. So one of the first things that is of paramount importance is to get the male tested when the couple comes. Along with the female scans and her testing, a semen analysis for the male is something that needs to be ordered more or less in the first visit itself. So now let's understand what are the different causes of male infertility. So it can be divided into three categories. That is, one is the hypothalamus and pituitary causes, one is primary testicular causes, and the other is the transport of the sperm related causes. Now, coming to the first thing, hypothalamic and the pituitary causes, things like Kalman syndrome, single gene mutations, increased prolactin, certain tumors, infections like meningitis, drugs. These are some of the causes of pituitary and hypothalamic disorders. Uh, Things like malnutrition also fall into this category. And coming to the next category of primary gonadal diseases, this includes one of the most important causes is varicocele. This accounts for the most common cause of male infertility. It means there is dilatation or swelling of the testicular veins, that is pampillary complexes, which increases the temperature and therefore the sperm production is decreased. This is varicocele. The other causes in this category include Klinefelter syndrome, Y chromosome microdeletions, infections like leprosy, tuberculosis, radiations, chemotherapy, and tumors, smoking, alcohol, environmental toxins, pesticides, exposure to pesticides. These are some of the causes, and certain chronic illnesses like liver cirrhosis or renal insufficiencies also can be attributed to male infertility. Now, the third category includes the sperm transport disorders. That is, if there is an obstruction in the epididymal duct, or if there is absent vas, congenital absence of vas difference unilaterally or bilaterally, certain infections like chlamydia, gonorrhea, STIs, all this fall into this category of causes of the male infertility. Certain syndromes like Carter-Jenner syndromes, Young's disease, and spinal cord issues. These are all that can cause infertility in males. Importantly, what we need to understand is lifestyle, and some of the causes include obesity, lack of exercise, alcohol, smoking, as I have already mentioned. Apart from this, wearing the tight undergarments, excessive usage of cell phones and laptops. These can cause these can cause actually radiational effects, wherein the electromagnetic waves can cause disturbances. Also, the heat produced by the laptops can be the reason. Alongside some of the other lifestyle causes include endocrine disrupting chemicals that are nowadays found in the various substances that we consume. So these also cause disruption in the natural hormone production of the body, which may include certain plastics, certain food that we eat, things like that, and the environmental pesticides and exposure to occupational toxins. All these include in lifestyle stress, of course, lack of sleep. These are some of the things that we can modify, and we can help treat ourselves also. These are some of the lifestyle changes that if we practice, we can have better fertility outcomes. The three most important things include healthy diet, exercise, and good sleep. So now coming to quickly, now that we've understood the causes, how do we go about these causes is doing a semen analysis, certain hormone tests that we can do, genetic testing also can help, along with scrotal ultrasound if and when required, also a DFI, DNA fragmentation index. Uh, Early visit to an andrologist or a urologist for men who have certain conditions is worthwhile. So this is all about the causes, and based on what is the cause and what are the hormone levels and the genetic tests, we can advocate a good appropriate treatment. So most of these can be treated even if there is no sperm. Nowadays we do have treatments for that as well, in the form of surgery or in the form of testicular sperm extraction. So these are the latest modalities where we can use the sperms even though they're absent in the semen analysis. So this is all about male infertility, basically the causes. Any questions, please? Does drinking energy drinks cause male infertility? Uh, Not energy drink per se, but it all depends on what is included in the energy drink. Like I have just mentioned, there are substances like endocrine disrupting chemicals. So a simple way to understand is what you cannot read or what you cannot pronounce. If it is a part of the substance you're consuming, it is better to avoid that substance. At what age can male infertility occur and how do we identify it? So, typically, if you are otherwise a healthy person and there are no other problems, no tumors or spinal cord diseases, and no erectile or ejaculatory dysfunctions like retrograde ejaculation or premature ejaculation or penetration issues, even these kind of things are not involved, so we can typically wait, and if your basic health is okay, we can typically wait and get a semen analysis done, and the couple comes in first for a fertility check. So how to identify is basically a semen analysis, and thereafter, based on the semen analysis, it requires some hormone tests like FSH, LH, estradiol, testosterone importantly, thyroid and prolactin testing. These are a must that we usually recommend. Based on the value of these, we give treatment in the form of hormonal injections or aromatase inhibitors, which are tablets, antioxidants, and antibiotics. These form the main line of treatment. Does any injury to the genital? Yes, injury to the genital organs can also cause infertility. Be it in the form of planned surgery, if there is any iatrogenic injury, or if a surgery is involved which may cause obstructions, or if there is an inadvertent injury otherwise to the testes, can cause infertility issues. So men who are more prone to these kind of problems, or who already have identified certain issues, it is better they consult a fertility specialist, get a semen analysis done. If required, they can meet an andrologist or a urologist as well. any other questions, please? Thank you so much.